guys, it's Fiona and I'm here with Dr. Jimmy and we're talking about general anaesthesia at Dame Street Dental Hospital. Does Truly provide general anaesthesia?
Yeah, so we're going to be the first dental provider of general anaesthetic in Ireland, maybe all of Europe actually. So our dental hospital facility is up and running now, the GA theatres will be open, and essentially what we want to do is we want to give people who didn't have access to dentistry or who have such a bad fear from their previous experiences the opportunity to build new bridges and to be able to have more dentistry done, and that was the purpose behind this.
What are the sedation options at Truly?
So in general with dentistry, there's kind of 4 or 5 sedation options. So the first thing is you just kind of have a dentist who's very mindful. So headphones on, TV on, telling you to take deep breaths. So that's just kind of mindfulness, I guess is the best way of putting it. You have inhalational sedation, which is the gas mask. We would remember that from when we were kids. You might have gone to the dentist. They'd give you laughing gas, essentially. You'd have your treatment done. That works for a short time. So you get about 5, 10, 15 minutes of treatment. Then you got tablet sedation. It's a tablet you take an hour before, relaxes you. It depends on your metabolism. May work better, may work a little less. So we don't know how strong it's going to be. So sometimes you have to be a bit more cautious in terms of longer appointments. IV sedation, which is what the bulk of what we do, is cannula in the arm here and flush medication through. With this, we can push you up and down and you're as close to being asleep in a dental chair as you can be. And usually you don't remember after, which everyone loves. And then the last, which we kind of exclusively offer here, is general anesthetic, where you're fully asleep. So that's like if you were going to have an operation in a hospital, you'd be fully asleep. When you wake up, everything's done and dusted.
So with the IV, you are awake, but you just aren't.
Yeah, I mean, like you'll see a lot on social media, people talk about conscious versus deep sedation. The idea is that I would say to you, you're going to be super relaxed, almost like you're a giddy kind of drunk. And then some people do snore, and snoring is great, because it means they're nice and relaxed and they stay open because they got to breathe when they snore. It's not guaranteed, but most people would be comfortable and they'll have all the treatment they need to be done on that time period as well.
So how are the other sedation options different from general anaesthesia?
The simple way of putting it, general anesthesia means you're general, as in whole body, you're fully asleep, okay? Yeah. So you're asleep, and they also do what's called paralysis. So what that means is you're prone, so you can't move. So as a result, you have a comfortable sleep, you have this procedure done, you also get local anesthetic for pain relief, and when you wake up, everything's done and dusted. With any other sedation we do or offer in Ireland, you'll always be an element of awake. So that means we'll be able to say to you, hey, open your mouth, hey, take a deep breath, because we always need you to be able to breathe, because those kind of treatments, we don't want you to stop breathing because you don't have any tubes or ventilators helping you. With general anesthetic, we help you breathe and we keep you asleep so that you're comfortable for all your treatment.
We get loads of Facebook comments being like, can I be completely asleep? Do you provide general anaesthesia just for nervous patients, or does it depend on the treatment?
It depends. So general anaesthetic is something that's been tried and tested for thousands of years for medical procedures and dental procedures in other parts of the world. It's not something that everyone needs. For people who have a real fear, they could start with sedation and say, okay, look, this is just not enough for me. I need general anaesthetic, and that's fine. With us having the facility here and available, we can book anyone onto it. We have consultant medical anaesthetists who will be responsible for making sure everyone's vetted and healthy and there's nothing underlying that's going to make their anesthetic a problem. But yes, anyone can have it if they feel like it's something they want. The risks of anesthesia are pretty minimal, and we know that from years and years of people having surgery, but we'll always do everything we can to make sure your risk of any issues are mitigated. And also we want to make sure that if you feel that's the right treatment for you, we're here to provide it.
While you're in the chair, you could start off with IV and then you could be like, crank it up, I want to be fully asleep.
Yeah, well, we could always do that. The anaesthetist can then just administer a different cocktail of drugs, and then all of a sudden you're asleep and job done.
What dental treatments can I get general anaesthesia for?
Whatever you want. Yeah, so the beauty of us having the anaesthetic facility in-house is we can offer everything. There's people I've met across my career who are too scared to even have cleanings when they're awake. I feel for them because it means that the experiences must have been that bad that something small is even so tough. So we want to be able to help these people. So whatever treatment you need, we can provide under general anaesthetic. There's a fee for general anaesthetic, and that's the only thing that kind of applies. What I'd say is you don't need it for everything. Most things can be managed in the chair with sedation, with the right dentist, which we have. But if you feel like you need it, we can do anything there. It's just about booking the time and making sure you're ready and available.
Yeah, you'd rather people be coming into the dentist. If they need to be knocked out, fine.
100%. Yeah, the beauty of having an option there is that it's there, right? So if we can try the simple way, great. But if it's not, we always go down plan B.
Do you recommend general anaesthesia for nervous patients?
Yeah, I think general anaesthesia has a history of being proven to be safe. So I think there's no reason why you couldn't have it if you're healthy, fit. So anyone can have it. But I think it's always worth trying tablet sedation, IV sedation first. And if you feel like, hey, it's not enough for me, general anaesthetic is always there. If you want to jump straight to general anaesthetic, yes, that's possible. It just means a little bit of workup to make sure it's safe for you, and then organizing a date because it's quite busy and tough to get space in theatre. But yes, anyone can have it. If you're nervous, I'd always encourage you to speak to your dentist here. What's caused that issues in the past, because if we can help mitigate those factors and make them better, maybe it's the case of you walk in, you have your filling done in 10-15 minutes, local anesthetic, you walk out and you're happy, because all those negative experiences in the past, whatever was there, whether it was the pulling feeling, the pushing feeling, the hand on your chest, if we can reduce those, sometimes even simple treatment is okay, but GA is always there. So we'll never say no to someone having GA, but we always say let's try simple things first and work our way up.
Because a lot of people are probably surprised with how different dentistry is now than maybe their last
100%.
experience.
Yeah, I mean, like from the time when I went to the dentist as a kid, I remember the needles being this big. Now I'm a dentist, I know it's this big, but I'll still swear on my life that that needle was twice the size. I think we always picture the negative experiences in our life as 10x and the positive experiences in our life as 10x as well. So if you have a good dental experience when you're a kid, that'll carry through with you the rest of your life. If you have a bad one, it'll carry through the rest of your life as well. So I think whatever it takes to make you comfortable in the chair, we're here and we're happy to provide. But all we ask is that you work with us and help us decide what stage we want to start at and what stage you want to go to.
What is the process for receiving general anaesthesia at Tralee?
We work the same stringent, rigid protocols that every hospital in the world does. You will meet the consultant medical anaesthetist, you'll have a pre-op workup, that'll include your bloods, your ECGs. We'll get in touch with your GP to make sure there's nothing that we're not aware of. Once you're medically cleared for general anaesthetic, the next step will be to schedule the surgery day itself. The day of surgery, you'll come in early in that morning, you have to be fasted. You can have sips of water up to a couple hours before. You then have your general anaesthetic procedure. Most of our procedures are short in duration, so 1 to 3 hours. So what that means is if you feel fine a couple hours after in the recovery room, that evening you can go home. So that's called a day case. If something's a bit longer, anesthetic was a bit tougher for you, we have overnight stay rooms. So you stay in overnight, you get your rest, you have a nurse and an on-call doctor to look after you. And then in the morning when you're up and at it again, you go home and you get your rest then. So all the steps are the same as what you would have ever had if you went into hospital, and all the processes are the same. It's just a case of kind of with us being open 7 days a week, 24/7, 365, we can tailor it for whatever day of the week you want.
And so usually is that something you decide afterwards, whether a patient needs to stay in or whether they can
Yeah,
go home,
well, a lot of these times the decision will be kind of 50% made before it even happens, because you'll know based on procedures and people and medical histories. But sometimes, yeah, it could be afterwards as well. But 9 times out of 10 we'll be able to tell you what to expect, and then it's just a case of seeing how your body feels after and deciding what's best for you.
Are there any risks or side effects with general anaesthesia?
General anesthesia has a proven track record of being safe. Millions and millions of people get put to sleep for treatments, both medical and dental, all over the world. Common things afterwards is you'll be a little tired, you'll be a little fatigued. Some people can get chest infections. These are all things that any anaesthetist will warn you about with any procedure. There's more sinister risks, but the risk of these are quite low. Now, we have to educate you on all the available risks and all the available consequences, because that's your right to know. But if you look at the track record, it's so safe. Like, you could probably, I don't want to say, but it's more dangerous to be in a plane than it is to be asleep. So I think it's not something that I'd expect anyone to ever have to worry about, but I'd always make sure that someone's educated about the risks before they make that decision. And as I said, if they feel that risk is too much for them, you just take a step back to IV sedation, which is 100x easier and simpler and safer. And you could always start with that and work your way back up.
And do you find a lot of patients who maybe thought, oh, I definitely need GA, I need to be fully knocked out? Do you think sometimes they're surprised IV sedation does work for them?
Yeah, definitely. I had a lady who I treated was told that she could never have dental treatment unless she was put to sleep, and we did a full mouth of implants for her with sedation. So I think you don't know how strong you are till you try, and what I find is that what I want people to do is I want people to give it a go, and I don't hold any grudges if, say, we start and then they say, look, I can't do it, and that's 3 hours not being any treatment done. That's not a big deal for me, but if they feel comfortable and I get the treatment done, that's a huge deal for that person. So when we look at the positives and negatives of what we do, we always want to give people time, and we always want to give people space to do things in their own speed and their own pace. And I think if they say to me, hey, let's try it, and they're ready, I'm always happy to go whatever stage of the process they want and try our best to get them to where they need to be.
You're never going to be huffing and puffing, throwing your tools away.
Oh, no, tools are valuable. We've got to keep them safe.
True.
Yeah.
What should I expect before, during and after the process with general anaesthesia?
Before, what you're going to expect is that day you're not going to have anything to eat, so you're going to be a little hangry. You're going to come in early in the morning, you'll get checked in by the nurses, they'll have a look at you, they'll give you your hospital gown, they'll advise you where your room is to keep everything safe. You'll then be waiting for your slot in theatre. Once you go in, you meet all the team, you'll be put to sleep, you have your procedure, and afterwards what happens is it's kind of a slow wake up. So it's almost like you had your deep sleep, and then when you wake up, you're slowly kind of coming back. First you'll open your eyes, eyes, then you feel a bit more normal, then all of a sudden you'll feel like you're drowsy. Slowly you start to feel more normal. Then once you have something to eat, move around, you're all good to go. So the process isn't really anything you have to worry about. It's you come in, you get checked in, you get told, hey, this is what's happening. Do you have any questions? Any questions are answered. Put to sleep. Afterwards, make sure you're okay, you're awake, you're up and at it, and then you get to go home.
And that all happens here at the hospital?
Everything's here. No need to go anywhere else.
Thanks so much for watching, guys. If you'd like more videos like this, feel free to subscribe, and we'll see you next time.